So what happens after an abortion? Normally, the bulk of the bleeding takes place in the first couple days after taking the misoprostol. Some women then just experience a little bit of spotting at the end or just the end of the blood altogether. Sometimes some women can experience just a whoosh of blood or a big amount of blood maybe 1 week later, 2 weeks later after their abortion that kind of comes out of nowhere and then disappears again. For other women, it may seem as if the bleeding is stopped, only to return again a week or two later with more of a vengeance than before. Sometimes the bleeding can come back even stronger than before and doesn't seem like it wants to stop. It's important to really monitor your individual symptoms, bleeding, and overall experience. You are your own best guide. You know how your body normally functions, and you know most naturally just what isn't normal. So just paying attention very acutely what is normal for you. And knowing what's normal for you, it's also what is normal for your vagina. Knowing how she normally smells. And if these smells are off, either it smells a little bit too much like bread, or maybe it smells a little bit like dead fish. If you're over on one or the other, it could be bacterial vaginosis for something that smells more like fish, or it could be a yeast infection for something that smells more like bread. Both of these are very treatable vaginal infections that it just takes knowing your vagina and knowing your body just a little bit to really get a handle on and not let it progress into anything more serious. When looking out for how your body normally feels, it's also important after your abortion to make sure that there aren't signs like a distended belly, as if your uterus has not gone back down to pre-pregnancy size, and maybe that there's still blood or tissue inside that's filling up. Sometimes a blood clot can get stuck at the top of our cervix and not allow tissues to pass through the uterus, through the cervix, and out through the vagina. When this happens, sometimes our uterus can start filling up with blood, and that can be a bit dangerous if it's not removed. Other signs to look out for are fever. Fever can sometimes also indicate an infection. Sometimes potentially an infection is even started within the uterus, and that can be a bit more dangerous than just a vaginal infection. So it's important to really monitor your body just in case of infection. Also, if you have bleeding that won't stop and the blood clots start coming, and they could be as big as a pea, as big as about this, or even as big as a baseball or a golf ball, it may be time to access a bit of outside help. If you live in a country where abortion is legal and where you feel safe to go to the clinic, it'd be good to go to the clinic and ask for a checkup, or ask them potentially for an aspiration procedure. An aspiration procedure is where they insert an instrument that goes in and just sucks out all of the contents of the uterus. This is a way to be 100% sure that your uterus is once again empty and that the process is 100% complete. If you live in a country where abortion is not legal, it's good to do a little bit of research into different clinics that help women or also do obstetrics and do procedures for miscarriage management. There's a lot of cases where your body can naturally pass all of the blood on its own, and there's no reason to have any outside intervention. But there's also situations in which your body simply cannot pass the tissue, and you will continue to bleed and could possibly get very sick or maybe even die without medical attention. So just to keep this in mind as you're managing your own bleeding. Another thing to watch out for, conversely, is no bleeding at all. If throughout your whole procedure and after taking the pills, you only had a little bit of bleeding, and maybe you didn't pass a fetus at all, or you weren't sure if you did, and then it's accompanied with no bleeding for the next few days, that could also be a danger sign, especially if this is accompanied with a lot of abdominal cramping. There's a potential that your body simply is not releasing the pregnancy, and this would also be a good time to get medical attention. Even though I've been maybe scaring you with some of the scarier aspects and realities of having an at-home abortion, I just want to let you know that a lot of these risks that I'm outlining are really the outliers, and you truly have all of the tools that you need within you, within your frame of experience of menstruation, to manage the bleeding and manage the pain and manage this abortion on your own in your sacred containers with pills. You are so supported and you are so safe. Thank you so much.